What we're talking about is an open label study of cannabidiol, which is one of the main non-psychoactive components of marijuana or cannabis, and its use in children and young adults for treatment-resistant epilepsy, which is epilepsy that hasn't responded to other medication. These are highly refractory epilepsies, and people have demonstrated results in these particular epilepsies. And that's a result of, a lot of times, the desperation of parents who sought out marijuana-based treatments and kind of were the forerunners of showing that marijuana-based substances could be useful. We've basically had 137 patients who've been on the medication for at least 3 months. And what we've seen is about a 53% reduction in median seizure frequency for all patients. And for Dravet syndrome patients, which is a particular type of very severe treatment-resistant epilepsy, we've had a 64% reduction. It's a liquid-based medication. It's actually, the compound is suspended in oil, so it's a twice-a-day medication. We go up to a weight or a dose of 25 milligrams per kilogram per day. So, you know, a 60-kilo adult, that would be about 1,500 milligrams a day. You know, a 10-kilo infant or toddler, it would be 250. Like with most anticonvulsants, we don't know the exact mechanism of action. We know that it doesn't work the same way that THC, which is the psychoactive part that makes you high, works. There are 2 receptors, CB1 and CB2, which are known to be the main receptors for THC, and cannabidiol does not work through those. It does have probably effects on the serotonin receptor as well as on calcium metabolism, but we're not sure the exact mechanism of action. So it's an add-on treatment. Many of these patients are on at least 2 to 3 anticonvulsant medications currently. So it's not replacing their treatment. The main side effects that are seen in a significant number of patients, more than 10%, are sedation, fatigue, decreased appetite, and diarrhea. These are rarely treatment limiting, where people have to leave the study because of them. So those are the main side effects. We do see some sometimes mild increases in liver enzymes, but this is thought not to be due to the cannabidiol, but probably the other medications they're on. Obviously, like any drug, it does have drug interactions. It can probably either reduce or increase the levels of the other medications, and that's being worked out. So that has to be taken into account. There's going to be, or there's a randomized controlled trial that's ongoing. This was an open label study, but a randomized controlled trial is ongoing that will try to work out some of that more. You have to keep in mind this actually has not anything to do with medical marijuana. This is an FDA and DEA approved drug. It's a purified form of CBD, cannabidiol, from the marijuana plant, but it's not any different than any other drug in how it's studied. So we don't rely on any state approval or any medical marijuana laws to get this through. We know that there's a lot of anecdotal evidence for marijuana-based treatments, what are called whole plant extracts, you know, otherwise hemp oil, that contain high amounts of cannabidiol, or at least some of them do, and that they may be helpful for epilepsy. So a lot of parents have heard about that. What this gives the advantage of is that we extract out the company extracts out the cannabidiol, and we know exactly what is in the product. And that's attractive to a lot of parents, because with what are called artisanal brands, you don't know what's in the product. So they've heard a lot of things about, you know, marijuana being useful, and this is kind of a more controlled way of administering it.